Well, good afternoon. My name's Charlie Reuland, and I'm the last one. I'm the only thing between you and whatever you need to do next. So thank you all for being here today and for all that you do. It does make me very proud to be a part of Johns Hopkins and to look at all the kind of people and effort that we've brought together here today. And I want to thank the organizers of this, and we'll do that again at the end here. But we consider it part of our core mission here, both clinically and academically, to include the Latino patients and families in our communities in everything we do. And I really thank the leadership of Centro SOL for making sure that we do that. You've heard a lot today. You've heard from Dr. Summers about the population health benefits of Medicaid expansion and the challenges of increasing healthcare access to undocumented immigrants. You heard from Mr. Page, our own diversity leader, about Johns Hopkins' commitment to diversity and inclusion and the challenges in meeting this goal, and they are not small. You heard from Dr. Sharfstein that work is underway to understand the healthcare needs of Maryland's Hispanic population. You heard from our patients about the challenges to and the benefits of access to healthcare. You heard from Dr. Mora about an opportunity to diversify Maryland's healthcare workforce. We heard from Mr. Barunda about his own experience and some of the issues faced here by our Latino community members. And finally, you heard from Ms. LaRue, si se puede, and the path of a bill through the Senate. I'd like that flow chart if I could have that for how that happened, because we would all learn from that. So I think it was a really great lineup that we all got. And so could we just take a moment to thank the speakers who put that together for you today. One of the reasons I was asked to close today's event is because the health of our Latino communities is something that I personally do hold dear as the Executive Vice President and Chief Operating Officer at Johns Hopkins Bayview. And I have a lot of pride in the work that our team does, and even though I can't help them solve everything, they do an awful lot of terrific work, and it makes me very proud the work they do. We deliver about 1,500 babies every year at our hospital, nearly half of whom are born to women who would describe themselves as Latina. In fact, I'm told that we are sometimes referred to as Baby View. I don't know if you've heard that one. And those babies do return to us for pediatric care, and we're a favored destination for strong, appropriate, and compassionate health care for these families. And our caravan is something that we're also very proud of. We do provide free access to preventive services to many Latinos and others in our community, and we think that this is all really, really important work. As we all continue to evolve in the U.S. healthcare system, I think that as providers are all really being asked to pivot more toward public health and away from kind of fee-for-service medicine and more toward longitudinal health of our communities. And for me, that's actually quite welcome. I trained here at the Bloomberg School of Public Health many years ago. And so in many ways, it's a return to my training roots to be asked to think like that. And I think that many of us feel that way. I'll sometimes ask a room full of physicians, how many of you trained, went to medical school and worked for all those years to bill a lot of RVUs? You know, and they will all laugh. But then when you say, how many of you went to medical school to make a difference in people's lives, people will all resonate with that. And I think that's why I think we're moving in the right direction generally. But it's pretty humbling. I think you all have heard today how difficult it can be to make these changes. I'll just share a couple of little stories. When I first started asking about health disparities at Hopkins Bayview, one of the things I learned was how difficult it is to actually demonstrate a health disparity with good data. Who are our Latina patients, and how do we know that? Do we look at you and decide that you look like you're Latina and describe you that way? Or do we give you a piece of paper and ask you to describe yourself that way? I challenge all the hospitals around to ask, how good are you at even understanding the disparities that you have? I think we're much better at it than we were 7 years ago, but I think we have a long way to go. It's very humbling, a little thing like that. Our TAP program that I think you heard about earlier today is a program that helps provide access for the uninsured and underinsured to specialty care when they would otherwise have a hard time getting it. That program is terrific, but it's limited and is ultimately constrained by some of the resources that we all lack. Dr. Polk and others in pediatrics have taught me that when you carve out labs, which is something that happens in the provider community to try to save money on lab costs, at the end of the day, it can mean that it's harder for the patients to get those labs and harder for the lab results to come back to Dr. Polk so that she can take good care of her patients. and that disproportionately affects our Latino community, no question about it, and our priority partners members. And so that's a challenge. And I obviously don't need to remind everybody in this room that one of the metrics that should be on all of our 10-year plans is to narrow the life expectancy gap that exists here, that in some of our zip codes, and it's 20 years different, less than 7 miles apart. I think you all probably know that. That needs to be on all of our radar as a goal. So we have a long way to go is the point, but out of respect for the people here, I'll try a little of my garbled Spanish to put this up. So, y mientras tenemos mucho más que tenemos que hacer, creo que nuestro sistema está evolucionando en la dirección correcta. Con el apoyo continuado, las contribuciones científicas y las contribuciones personales que ustedes han traído hoy, sé que este grupo avanzará la salud colectiva de la comunidad latinoamericana. Estoy entusiasmado para continuar este viaje juntos. Is that okay? I get that right? So thank you. And why don't we take one more moment to thank the organizers, Dr. Polk, Dr. Page, and Central SOL's program director, Monica. Could you all just stand for one more time and let everybody recognize you for the work that you've done? Thank you. Thank you all for coming today.
Yo quiero agradecer a los voluntarios que me han ayudado hoy. Han sido 4 o 6 manos y otras 6 piernas. Thank you to the volunteers, Jarita, Adi, Mónica, María Juliana, Rafael, and all the people who helped today. Thank you. And thank you all for coming. Thank you speakers, thank you attendees, thank you so much for supporting this. Bye.